Hey there, Dr. Fetich here, Village Family Clinic, coming to with our health essential update here. So, what happens after a couple of weeks of care? So, once we're in care for a couple of weeks, we'll do a reevaluation. So, typically around 10 to 12 visits, we'll bring you in a room. We're going to do new back scans of your spine if we did them, compare them to the old one, see if we're getting better. We'll also do a little checkup with the doctor and a new posture now, see how we're doing. Hopefully, we're on our way there. Usually, most of these problems resolve 24 to 36 treatments. So hopefully after 12, we're doing pretty well. So we're going to check on that after about 12 treatments here. Sure, I'll explain a couple little things here for you. So one, this is our little spine chart. So just so we know, every part of the spine goes to a different organ, tissue, and cell. So a lot of the nerves in the neck control things like headaches, sinuses, allergies, hay fever, even allergies. So getting your neck adjusted might be able to help your allergies or a friend or family you know. Down the lower part of the neck, things like bursitis. So a lot of shoulder problems are actually coming out of the nerves in the neck. And the middle back, a lot of those organs go to the chest and lungs and organs, I think. So even kids with asthma can be helped by chiropractic adjustments, gallbladder problems, the liver, stomach, all these nerves come out of the spine. If they're being compromised out of the spine, might be a reason for some of those issues that we're having. Down the lower back, mostly those nerves go into tissues in the pelvis, things like your sexual organs, uterus, bladder. Those things can be helped with chiropractic care as well as digestion. And all those nerves go down to the legs too, as well as sciatica. So some of the other problems you or someone you know might be having could be related to chiropractic, as a nerve may be compressed somewhere in the spine, could be causing a problem. So when we're under care, people always ask me how often to start coming in. So once we're feeling better, we always recommend maintenance care. We've done a lot of work to get you feeling better. We don't want to let that all go. So one of the things we'll draw about, again, is this triangle we draw with the optimal health line. Everybody's feeling great. Down here's the pain line, and you probably came in some pain down above the pain line. So a series of adjustments after a couple of weeks is going to get you above that pain line here. And then what we want to do is stay above that. So there's kind of different ways to do that. So hopefully once we get you up to feeling really pretty good, there's different maintenance care. So a lot of times some people come in once a month. And so if we don't do any kind of treatment, we'll go back down and cross that pain line again. Coming once a month, we'll certainly be able to slow that down for you. But eventually that's usually not enough to overcome sitting at a desk 8 hours a day or working hard, driving, yard works, all that kind of stuff. Now, if we come in every 2 weeks, that'll certainly slow it down a lot more. That usually works pretty well for most people, but there's still, you're beating your body up for 16 hours a day. You're in here for 15 minutes. Ultimately, once a week is going to keep you as good as possible to closest to healing that optimal health line. So, if we let these things combine, go by for years and years and years, that's how people end up with walkers, canes, hunched over, having trouble walking, and keeping you above this line and as close to optimal health as possible is really our goal here. So hopefully taking account of that, once we get you feeling better, we want to keep it that way and keep it going as long as you live. We tell patients, we're going to be a patient of ours until one of us dies, right? Me or you, we want to take care of your entire life, as well as your friends and families. So make sure to bring our friends and family in under care. We don't want them to suffer the same problems you may have had. Also, if you have any groups or civic groups, we do talks, free health lectures in the community. We got to get the word out to as many as people we can. We do spinal screening talks for any companies in the area, friends or family, and that kind of stuff. Moms groups, kids groups, all that kind of fun stuff. So might be interested in that. Just tell them to give us a call or text at 908-813-8200.